She hasn't menstruated for several years and she wants to do the mint lift. About a year and a half ago, she did do the mint fines because they're easier and it looked like all you need to do is pull the lower cheeks up. They only lasted a couple months because unfortunately when you haven't menstruated for a few years, the collagen is not as strong. The barbs are not as strong on this mint lift, so they do pull through. Use those mainly for the young ones. So instead, now she's going to do it with the mint 43s, which I'll be showing you how to do. They are a little tougher, but they work better. They have bigger barbs and they pull much better. You're going to see her cheeks up so much higher. These are where the mint 43s will be going. They're pretty symmetrical, a little higher on her right cheek because her right cheek is a little higher. And the pulls will be a little different. So she's having her hair braided before the procedure so it doesn't get tugged into the wounds.
Face is first made numb with 45 cc's of 0.5% lidocaine and 1 to 200,000 epinephrine with 5 cc's of bicarb and with 30 gauge and 25 gauge needles in the subcutaneous plane.
This is the table for the mint lift 43s. You got the mint 43s here, some extra drapes, the special needle, the threader, something to cut, something to pick up, something to make the holes with, some little extra lidocaine with the needle for it, and then some HiPAA and some sterile gauze. It's been 15 minutes, which means now the numbing's had a time to turn white. Turn a little bit that way first. So there's a little bit that's not white, so I'm going to connect the dots a little bit to help turn it white, and then turn the other way. And the same thing kind of there. Chances are, if I don't, she'll say ow there. So I'm going to give a little extra at the very beginning.
So now you prep the face with HiPAA and then you add some more local anesthesia wherever it isn't completely white. And then you put on the drapes on the table and on the head. Then you do a 1.5 millimeter punch incisions 1 centimeter apart in the temporal hair. Then you pass this passer into the temporalis fascia and one and out the other hole. Then you pass these threads in. I only like to put them in an inch. Here you put them all the way. All it does is kink the thread, so just put them in an inch. Then you put the passer with the sharp thing in. First, the passer is the blunt part, is what's going through the tissues. The sharp is only to poke through at the very end. Put the thread in after you take out the blunt passer each time. And you stay in the subcutaneous plane. You go in more superficial over the zygomatic arch over the bone, and then when you get into the cheek, you lift the cheek to make it go a little deeper. You pull the soft tissue up by palming it while you're pulling on the threads. You cut them off, making sure there's no excess. That's why I use that bent scissors. And you're doing the same thing on the other side. Once again, you'll just put it through. Now you're seeing the differences. This is if you only cross the top one. Here the most superior pole is in the middle. Here you're not crossing it at all, and the most superior pole is going to be in the top. In reality, there's no specific superior pole. Here, when you cross all of them, you get a superior pole in the bottom. It also bunches it up. This is chosen in her case only because the right side was actually already bunched up. This will make her more symmetrical by trying to bunch up the back by pulling the lower back up. And then you do the same process. So we're starting on the lower hole and going through. So first, you put that through, and then you put the thread through, and then you pull out the passer, and then you do the next one once again through the lower hole. And I'm always lifting the cheek when I'm going through the cheek because I want it to go deep but on top of the muscle. And you're doing it for all four, and each time you're passing the thread through. And I add a little more local because she felt that a tiny bit there. Nothing else did she feel. When you make sure you pull any hairs out, you pull on the threads, you palm them up, you cut off the excess while pushing on the skin, wipe the face clean, you pop any threads so that they don't look excessively high. It comes off the barbs very easy and painless. You put some gentamicin cream on it.
So it's been nearly an hour, and she can turn this way. I tried to release any dimpling. There's still a lot of numbing, so she'll come back tomorrow and we'll see how she looks. It's one day after mint 43. I released some of the threads only on the left because it was a little high, and now they're more symmetrical. And then look straight in here, and you see that it's actually a lot more here because this side was kind of high over there to begin with. So what we did by pulling from here to here is really pulled this side up. You can see it's pulling more. And then over here, we just tried to pull the whole thing. So the high one, which is this one here, is only in the center. Just tried to pull the whole thing because it's already high here, so we didn't want to bring it any higher. So it's more symmetry, but it is just the very next step, so we gotta give it a little time.